Welcome to Toledo Clinic TV. Our guest is urologist Dr. Omar Khan. And something that you see quite often in your practice is a condition known as overactive bladder. What exactly is that?
So basically, overactive bladder is when a patient has the urge to go to the bathroom frequently. Sometimes it's associated with leakage as well when they don't make it to the bathroom in time. And it's something that's very bothersome to patients and something that I think a lot of patients will try to live and just fight through because they think that they can't necessarily get help. And we see that a lot.
Is this more common in men or women?
It's definitely more common in women, but we do see it in men as well. But definitely, predominantly, most of the patients that we see with overactive bladder are women that will also have some leakage associated with that urge to go to the bathroom.
Is it painful at all?
It's no, it's not necessarily painful, but it definitely affects their quality of life, and it definitely makes it harder for them to go about their normal daily, everyday activities.
So how do you know when it's something that you need to actually visit a urologist for? You know, most people are drinking a lot of water during the day or coffee,
Yes.
and so they're going to the restroom regularly.
And I think that's one of the biggest things is that people, it's something you can live through, but it's something that causes a lot of bother. I think it's a case-by-case thing. It depends on if it's debilitating to your lifestyle, if it's something that you want an improvement on, then absolutely you should see your urologist. There's no set time where it's like, okay, this is a problem, because it varies for each and every woman and each and every man. It really depends on what they consider normal. And if it's abnormal to them and they feel like they're voiding too much or they're not able to make it to the bathroom, then they should definitely see a urologist.
And what treatments are available?
So usually we start with behavioral modification. There's certain exercises that we can do, Kegel exercises, and then we also try to work on patients' diets to try to get them to cut down on acidic food and spicy food and caffeinated beverages. If behavioral therapies don't work, we move to medications and we try them on certain medications. And if those don't work, then there's more minimally invasive procedures that we can do to actually calm the bladder down and get that overactivity to just go down a little bit.
Is this something that could potentially be dangerous, or as you said, is it primarily quality of life?
It's primarily quality of life, but a lot of the times people will come in with the symptoms of overactive bladder and there may be something else more serious going on. Sometimes there's bladder cancer, sometimes the patients aren't emptying their bladder well, and that's why they're going to the bathroom a lot. It's because they're not fully emptying their bladder. So there's a lot of things that we can unmask when we see a patient with overactive bladder.
Okay, so the bottom line is, if you're concerned,
absolutely,
come see a doctor.
Come see a urologist, absolutely.
Okay. All right, thank you so much for that information, and we'll be right back.